Midday Report with Chris Gibbons on Talk Radio 702, your number one news and talk station.
Well, Midday Report it is, 26 minutes, and still much to be discussed regarding the implementation of the government's proposed national health insurance scheme. That is the view of our next guest, who is Clayton Samsodien, Managing Director of Genesis Capital's healthcare subsidiary, Genesis Healthcare Consultants. He joins us now on the line from Johannesburg. Clayton, good afternoon to you, and welcome. What are your main concerns?
Good afternoon to you too. Look, our main concern is that the document still lacks some clarity. We obviously welcome that there is some information as to the way forward, but clearly the cost of how this is going to be funded, the resources insofar as doctors, service providers, nurses is of a concern to us. The blessing though is that it's now finally that said that medical schemes can exist alongside NHI, which we believed years ago would be the case anyway. But now that it's clear, we're really happy to see that move.
Now, it's been made clear that above a particular level of income you're going to have to pay. What do you think an appropriate earnings threshold would be?
I would imagine that they're going to pitch it at the same sort of levels we exempt from paying tax, which is about 4,750. So I'd imagine persons earning over 4,750 would have to contribute to NHI. And that together with the reduction of the rebate of your medical scheme contributions, I think is going to cause a bit of an uproar on the middle income range. So you might find that those employees and members would possibly move to NHI. If hypothetically they're contributing 300 Rand, we would see they may contribute that amount together with top-up cover. But if the contribution to NHI is much higher, say 1,800 Rand, they may just leave private healthcare altogether because they'd now be forced to contribute to NHI.
You don't have a choice, do you? Well, one of the problems, of course, is that many middle class can simply wind up paying twice, one for NHI and one for ordinary old-fashioned expensive medical aid. Can our economy overall really afford this?
Well, according to the minister, yes, it can. I think the argument at the moment is that 3% of GDP is being spent on healthcare. So whether this is spent via private healthcare or via NHI, the belief is that we'd still be able to fund it. From what we see is a lot more of a pilot project being run from April next year, which we appreciate. We appreciate the 3-month comment allowed from the public. And yes, I think everyone in the industry, from the regulator to the Board of Healthcare Funders, are welcoming the step to universal healthcare for all South Africans. So we see, yes, it is definitely affordable. If the state facilities are improved, look, medical schemes are already using as it is for chronic and some hospital procedures. And if the state facilities are improved, that would have a dramatic impact on the affordability of medical schemes.
On that topic, Clayton, it's been suggested that every cabinet minister, every government official should be mandated to use the NHI and state facilities just to make sure it works properly and not themselves to go private. Would you support that idea?
Yes, of course. I think we all need to test it. I for one wouldn't be shy to test the NHI facilities. We've also seen in the green paper that a certain body will be released to monitor the norms and standards of these facilities. It would need to be accredited first before they can contract to NHI, and that gives us some peace of mind that a certain standard will be kept in these facilities.
That's Clayton Samsodien, Managing Director of Genesis Healthcare Consultants, talking to us from Johannesburg. Clayton, appreciate your input here on the Midday Report. Time is 12:30.